So today we'll be looking at another question from INICET November 2022. So this question is also on nicotine. So the question talks about a chronic smoker wants to quit smoking. So under psychosocial support, which of the following drugs can be used? A is varenicline, B is sevimilin, C is mirtazapine, and D is neostigmine. Okay. So out of all of these four, varenicline is the only option, the only drug which is approved for quitting smoke. Okay. So correct answer is A, varenicline. So usually what we see in clinical practice, we combine pharmacotherapy with psychosocial support. So we need both the keys to unlock the behavioral loop. So this is also what is given in Tasman. So NRT and Bupropion or varenicline with behavioral supportive social treatment, with supportive psychosocial treatment is given. Okay, so let's look at the other options as well. Okay, so sevimilin. Okay, so pharmacotherapy on nicotine is dependence. Okay, so before that, we just want to look at the pharmacotherapy for nicotine dependence is designed to be combined with psychosocial support, as we have already discussed, not to be used as a standalone substitute. Okay, so it always has to be combined. Okay, let's see about the other options, why they are incorrect. So sevimilin, it's a muscarinic M3 agonist used for dry mouth as in Sjogren syndrome, unrelated to nicotinic receptor pharmacology. Okay, so M3 is making spit, not dopamine in our brain. Okay, so the site itself is wrong. Second, this is important, mirtazapine. Okay, so you can see this mirtazapine is one of the antidepressants that has been given as one of the options, albeit wrong, because the other antidepressant, bupropion, is indeed FDA approved for nicotine cessation. See, so bupropion is mechanistically hitting the dopamine pathways. Okay, this worked for sedation, but mirtazapine, being a non-adrenergic and specific serotonergic antidepressant, this is not having any dopamine. So usually the logic behind giving dopamine, which is a unique antidepressant, is that it only works through dopamine. It stabilizes the dopamine, and dopamine spikes is what actually is responsible for giving you the hits after smoking. So once you stabilize it, stabilizing the hits, the person will not be able to get as much as a kick that he would have been if off Bupro or bupropion. And mirtazapine doesn't have any dopamine stabilizing property, so mirtazapine is of no use. Okay, so antidepressant doesn't cure nicotine dependence. Okay, the actual receptor mechanism does. So that's why dopamine is the actual thing. So mirtazapine will not be a correct answer in this case. Okay. Okay. And the other option was neostigmine, which is an acetylcholinesterase inhibitor. As you have already read about it, it's used in myasthenia gravis. Okay. So with that, so this is once again another question on varenicline. Okay, so varenicline is one of those agents that we can use to quit smoke in patients, along with the other options being NRT, bupropion, with and all of this always must be paired with a behavioral treatment or psychosocial treatment. Okay. Hope you have learned something from today's MCQ discussion. Hoping to see you in the next session. Thank you.